Thank you. So continuing our session, next up we have a talk from Dr. Major Ameya Kagali. He is a consultant sport medicine Ramaiah Memorial Hospital and Karnataka State Cricket Association, Chief Medical Officer Paralympic Committee of India, Team Doctor of Rajasthan Royals IPL 2025 and co-founder of Krida Human Performance Center, Bengaluru. So we'll have the talk from Dr. Ameya Kagali. To chair the session, I would like to invite Dr. Prabhu Raja. Dr. Prabhu Raja, please come up on the dais and take the chair. Welcome, Dr. Prabhu Raja. Dr. Prabhu Raja is the Head Associate Professor, Department of Exercise and Sports Science, MCHP, Manipal Academy of Higher Education. We welcome you, sir, for the chairing of the session, and I would request you to introduce the speaker.
Thank you, ma'am. Thank you for the kind introduction. Good afternoon, everyone. So, Dr. Ameya Kagali. He's an Indian sports medicine physician with a unique blend of military precision and medical expertise. He served as a regimental medical officer, gaining early experience in leadership and high-pressure clinical care. He currently serves as a consultant at the Ramaiah Medical Hospital and Karnataka State Cricket Association, and he's a team doctor for Rajasthan Royals. He's the co-founder of Krida Human Performance Center, which focuses on advancing integrated athletic rehab and performance training. He dedicated advocate for holistic athletic welfare, focusing on physical, mental, and ethical dimension of care. So his work emphasizes on performance optimization, holistic support, and advocacy, ensuring that para-athletes' medical, logistical, and dignity-related needs are met. Over to you, Dr. Ameya Kagali.
Cursor only.
Yeah. Because the brightness is too much, the pointer is light.
Good. No worries. Thanks. And can I change the slide from there? Can I change the slide from there? Change the slide?
Oh, yeah.
Can I change the slide from here? It's okay, I'll change it from here. Good afternoon, everyone. Thank you for the introduction. And it's a bit of an irony. I'm talking about tech in sport, and we are a bit technologically challenged right now. Nonetheless, so I'll be giving you, first of all, how many of this distance is a little worrying for me. There's too much distance between me and the audience. This is the first for me. Anyway, how many of you are interested in sport? Just to play, be involved, watch sport. I mean, man, it's really disappointing. Not too many academicians and researchers, I guess, in the house. Anyway, but I deal with a lot of athletes, and I'm privileged. And more than athletes, I would say I deal with a lot of fit people around me, which encourage each other right from the background of the armed forces after I finished my MBBS training in Pune. And then working with elite teams right away, start my career with the Indian hockey team, then followed with para and so on and so forth. But throughout the journey, what has shaped my journey thus far with the medical expertise or the medical knowledge that we all gain in our undergrad and postgrad courses is the use of technology. There's no escaping technology from day-to-day lives to the professional lives. So I think the main aspect is the integration. It's basically to make not just our lives easier, but to make the lives of us and the clients that we work with a lot more objective, a lot more precise, right? So it's no more science is moving towards a field, especially in sport. I'll stick to sport, where it's not about what you feel anymore, unless, of course, it's a branch of psychology. I come with a physiological background, and so we want to measure up to the last decimal as to what is happening in high performance sport. And that might be toned down a bit if I'm working with recreational athletes, or in a population which is more generalized, that is working professionals in the IT sector or in the medical profession. So the objective is to obviously monitor, prevent, and then diagnose, not the conventional, not what a conventional medical professional would do. Generally, you go and see a doctor or a physiotherapist if you're in pain, if you have, if you have a fall, you want to rehab. But what happens in sport is that it's like an annual health checkup, which you start maybe after 50 or 60, maybe a cancer screening or something like that. But in sport, we start this. Even my youngest athlete is an 8-year-old swimmer. So she's absolutely fine, nothing wrong as such with her, but we want to track the athlete's progress from a very young age. That might include and not only restricted to certain blood work, see monitors like your HSCRP, serum cortisol levels, vitamin D, calcium, magnesium, zinc, potassium. And so I'm coming to the point is that we are not here to exclusively diagnose a condition, right? Sports tech, of course, it's just one of the aspect of sports tech. Then, of course, rehabilitate injuries efficiently is fine. Then I'll be talking about my experience across hockey, Paralympic, and cricket, of course. So the core objectives is, again, as I started, it is not to diagnose a condition, it is performance enhancement. So anybody who walks, in the clinic, or when I walk into a sporting setup, and by the way, that's one of the differences too, where in a conventional setup, again, you have the patient or the client coming to you. Here we have to be on the field, and if some of you all would take up a career in sport as a sports physiotherapist, you all will have able to relate, where it's not always the athlete or the client will come to you and you will be sitting in a nice, cozy chamber. It'll be hot, and kudos to the organizers for picking this place. It gives a very feel-like environment. So you'll have to running around a lot. There is no scope for hierarchy, unlike in a medical college, in a physiotherapy college. So everyone's in shorts, you're running around, and it's a much more collaborative approach. And of course, injury prevention, because once you start tracking, you'll exactly know which side is weaker or stronger on a particular athlete, not just from a skill perspective, but also from a joint perspective. Giving an example, if there's a badminton player, we like to slot it as it's a non-contact, unilateral kind of a sport, because a player who's smashing with his right hand will not use his left hand suddenly in the middle of the game. As opposed to a 100-meter runner, you have all the 4 limbs working in sync with almost a similar amount of strength and power and force required, right? Then rehabilitation, optimization, and then finally the return to play, which is the most important aspect, be it for a coach or the team manager or the media, anyone. We just want to know, when will this ex-player be back on the field? So I'll dive straight into about 4 or 5 commonly used parameters. One is the easiest and the most portable, that is the handheld dynamometer. I'm sure you guys have heard about this equipment, or even seen, or some of you might have even used the equipment. It's portable, reliable tool for quantifying isometric strength predominantly. And now I need to delve into what is isometric, eccentric, concentric, which I won't. So it's just that you make a fist and you try to clench as hard as possible, give it 3 readings, then you get a parameter. Now, where this is used is, again, in a post-injury assessment, where we see a lot of wrist injuries in, say, spinners, fast bowlers, or batsmen who like to use their wrist a lot, especially down south from Andhra, Telangana, Karnataka. We are known as very wristy players. And then, of course, the bilateral comparison, like what I told you about in swimmers, for example, in a butterfly stroke or in a freestyle. in backstroke. So when you're going there, what is the flexion of the right shoulder as compared to the left? Or external rotation or internal rotation, because that will ultimately define what muscle is firing and at what rate it will be firing. So and that will help judge at what force has been created and how good his performance is eventually. So I think this active force 2 is one of the equipment, and then of course we have this. We also have the muscle meter from a company in Australia which we use, and we have some very good results. So it's not a passive kind of a test. You need a good trainer for it who can match up to the strength of the particular athlete. So I prefer it to be done by somebody who's a little more physically stronger, and that's where our fitness also is equally important as compared to the athletes. You have an NBA player, 6'4", forget NBA, anyone who plays basketball, 6'4", to match up to his kind of push of the shoulder flexion or his kind of throwing. You need to be equally strong because you're giving the counter force to it, right? Then here we have, and we also modify the kind of testing that we do. This one is a 21-year-old swimmer that he comes to my center, and he's training for the Asian Games to be held in Japan next year. So any idea, like, these are not the actions that you will do in a day-to-day life. Okay, but these are the key components when you break down a swimming mechanism. How will his arm come? So that will be the shoulder adduction in 90 degrees, and from there maybe an external rotation, or getting it back to abduction from adduction or adduction to abduction. So these are the fine sport-specific tests that we can use, and the gentleman is my staff there who's holding the muscle meter. You see how much his forearm muscles are also tensed and can be seen. That's the kind of pressure he's applying. That's how strong the athlete is. Because if you don't do that, you will get a reading which is far more abducted more than 90 degrees. And it'll give you wrong readings. So you'll focus on other muscles while training the particular athlete, right? Now similarly, when in swimming, everyone knows the kicks are so important. Now I could have done the flexion of the knee joint or the extension of the knee joint in a seated position or in a prone position, in a supine position, right? But it has to be a prone position because again, we have to, come out of the box and start making the test more sport specific. Now, the elder brother or the beast of the isometric testing is the isokinetic dynamometer. It's like, anybody has seen the IKD chair as we call it? Yeah? Students, anybody? Excuse me. No? Any followers of Game of Thrones? Because it's just like a throne. All right? We'll see what it does. Now here, it's completely automatic. We enter the data of what we want from the athlete. I'll take an example of a javelin thrower who had a shoulder injury, and with 6 months of rehab, how did he face there? After 8 months, how much? After 9 months, how much? After a year, what was the data like? Which will help us plan his throwing much, much better, right? And here in an isometric, you're just applying force, there's a counter force, and it's right there. But in an isokinetic movement, you're doing the movement, or the leg extension, or the hip. Every muscle, every particular joint is put to test, and we also tell the athlete that it is like a workout session in itself. So the criteria for me would be a 24-hour rest before and after the test. It's quite high intensity, and the more the athlete puts effort, the counter force is even higher, right? And yeah, and then it evaluates the agonist and antagonist. So it's a good way to measure the HQ ratio, the hamstring to quad, which is very important for runners, football players, hockey players, squash, tennis. They have a lot of change of direction movement. So you want each and every fiber to fire at their optimal level, right? Thank you. And any kind of bilateral asymmetries, again, it's sport specific. less than 10% for any bilateral sport, and less than 15% for a unilateral sport. Now, what does that mean? So if I have a force generating by maybe my right shoulder flexion, if I'm a right arm fast bowler, it'll obviously be higher than my left. Similarly, all the righties in the house, when you write, your fingers are much bigger. One side has to be bigger than the other. No two sides are equal, right? But how much is unequal will eventually decide on how much load it's bearing. And that's where that data will help us in injury prevention. So it's not a direct approach. It's a very indirect and the history that is monitored for a very, very long time. And what is RTP? Anyone? What is RTP readiness? RTP or RTS? Anyone have heard this term? I've purposely put some abbreviations to understand where it's come from. Anyway, RTP is a very common lingo used, that is return to play, or RTS is return to sport. So that's my lab here where I studied. I did my PG in Auckland University in the New Zealand, and that's the isokinetic dynamometer, the chair what I was talking about. And this is where we are at Ramaiah Memorial Hospital. This is a javelin thrower that we are speaking, para javelin, Sandeep Kumar, and he's participated in a couple of Paralympics. So again, as I told you, we can actually design which joint that we want to test and which position, so that can become a completely supine table. It can become an inverted one where we want to test the hamstring ratio or the quad strength ratio, or when we're testing the shoulder, we can make the athlete sit or even lie down. So this is what a report looks like. I'm sorry it might not be very visible for you guys, but it is again Sandeep's report itself. So the total work done, concentric IR to ER ratio, that is the internal rotation to external ratio. So there we can see on the right hand side is 30%, while the internal rotation and external rotation is there. So we know that it gives us a kind of a pathway that are we on the right track? Are we on expected lines? And why is this important is because an athlete, when they come to us, they have only one question: when will I get back to playing? When will I get back to sport? They are not bothered about how good they are while they are at it. So even if they tell ACL fata, when will I be ready? Be it post-op, be it conservative, I don't care. But make me ready for the next game, which is a little different in our clinical setting. They ask little more questions that we are used to hearing. You know, kab chal paunga? Can I do the things I did before? So that's the difference between that 1% of high performance that we talk about and what the recreational or the general population requires. Now, just to show, this is the basic report. It has to be, we of course discuss it with the coach, with the athlete, and if need be the team manager too. And we tell them, we give them a plan to what can be done and what most importantly should not be done in a case like that. The actual report generated is a 5-page PDF minimum. The remaining 3-4 are all the graphs and how much it's going. So it's quite visually appealing actually. But many of my athletes or the coaches, they don't understand it, but we don't expect them to understand. So it's just like, this, and after that a summary of what needs to be done from here on. The next test is again from a strength perspective is going to the endurance athletes. We have our runners, and from the last 2 years, we are also monitoring the fast bowlers of the Karnataka Ranji team and the fast bowlers of the Rajasthan Royals on the VO2 Max setup, just for them to last. How much can they bowl in that much time? 5,000 meters runners, 3,000 meters steeplechase, 1,500. So any of the long distance runners or even the mid distance runners, because this directly impacts how good their lung capacity is. Some are skillful. It's not a parameter for how skillful they are. Okay, it's just one of the parameters that we can imbibe in a good athlete history. So, VO2 max is like the mileage of the athlete. How much consumption is there at the cellular level of oxygen? A good car is known by a good mileage, right? And a good mileage, what all to be done for getting that good mileage? So, We do it, like in India it's still not there, but in UK, Loughborough University has this test suited for a wheelchair-bound athlete too. So we have cycle races in para-sport, and that's purposely I've put that picture. If you can see, it's a para-athlete, and then what are the factors that ultimately define the VO2 max. So again, quantifies aerobic capacity, recovery efficiency, so you have a beautiful graph. We want that graph to be like a nice, slow coming steep, that is delaying fatigue. And then once you fatigue, it should come down rapidly, which will enhance recovery. So you can easily see the graph and tell if it's more like a parabola and then another delayed, like a big, nice, curvy mountain, it's not a good space to be in an elite space. But if it is a very nice, steep, slope rise, hit a nice peak, and then drops down immediately, tells that there's very gradual levels of fatigue, and there's instant level of recovery that defines a good athlete. And of course, in the clinical space, of course, I don't work in this space much, but since I'm associated with an institute that does, I have the opportunity to see what is PQLI, cardiopulmonary fitness. What is PQLI? Anybody? Physical Quality Life Index. So it's one of the, I won't say the single most factor, but at least definitely in the top 5, which will define. A higher VO2 max will obviously tell you how good your lung and your heart are working. And you guys should be lucky that you are in Bangalore and not Delhi. And again, the life expectancy post-chemo, after they take the particular medication, how good they are. Of course, the speeds, the protocol are very varied. It's much more subdued as compared to an elite athlete. And the prognosis of various pulmonary conditions, COPD, bronchial asthma. But of course, you need to have an extra intensivist and a team ready if things don't go as planned. So the test looks something like this. That's again, I've given comparisons, our lab in New Zealand, and that is our very own in Ramaya Memorial Hospital. So that's an elite runner. He was again training for the Commonwealth Games in 2022 in Birmingham, and next is in Glasgow, so he's gunning for that. Able-bodied athlete, wonderful results. We did his lactate threshold also to see how well he's fatiguing and when he's fatiguing. Again, the protocol is different. Some like to have a warm-up, a gradual increase. Some like to go on an incline. Some like no incline, but take the speed to even 20 kmph, 25 kmph. We've gone up to even 26 kmph. Just that the limit of this treadmill is not more than 24 kmph. And the limit of that treadmill is around 40 kmph. So you can imagine, like, humans, the fastest human, Usain Bolt in a 100-meter race, you know what his top speed was? Any idea, anybody? Top speed of Usain Bolt is 44 kmph. That's the time he hit in that world record-breaking 100 meters. Yeah, and out of all whatever little I have done with my athletes, this remains my proudest moment while testing this athlete. And this is Mr. Sharat Kumar. You see what happens in the VO2 max test, right? You're breathing in an airtight mask. So you're at a point, it's very claustrophobic. Okay? Now I'll give you another stat. This is a blind athlete. So he has no stimuli coming in from the visual senses. Only the auditory senses. It was a Herculean task dealing with this gentleman. He went on to win the silver medal at the Para-Asian Games in Hangzhou in China. And we did around 3 tests on him with 3-4 months apart. And that was phenomenal in his training. So I would stand on his left while running, and I would tell him that, Sharat, this is the speed that we're hitting now at 5 kmph, 8 kmph, 10 kmph. So he could only answer by his hand. He can't talk, he can't see. Okay? He can't talk obviously because of the mask. So I mean, what I want to do is that let's not restrict it to just a certain aspect or a certain few individuals who can do the test. We need to work ways around, get technology to people who, even to this population of people who are training at a certain level. And of course, this was another VO2 max chamber. Now, any idea what is the difference between this and maybe these two? photos. If you've seen that, here what we did was that I was interning with the New Zealand Olympic team. They would create the whole atmosphere in this chamber as to how it will be in Japan. That time the Olympics was in Japan in 2021. It was delayed by a year. So what they would do is that they would see what is the temperature if the schedule is out already a year in advance as to when is the particular event happening, what time of the day, what will be the conditions like. So they simulate the environment there. In Japan, if it's 35 degrees, humidity of 70%, at an altitude of so and so, what will it be like running in that environment? It's not like, you run here, you practice out in the field now, and then you go to maybe Chennai or Delhi and run. There is a lot of external factors which define performance. And again, it's the 1% club that I'm talking about, right? So in this chamber, we created a whole environment. By environment, I mean the physical weather of Japan, where the athlete will eventually be running. And we don't suffer inside, so we come out and we try to monitor and track what is happening with the athlete inside that chamber. So this was the start of it. This is, I think, a pic taken in Netherlands in the early 1950s, 60s. So this is how it was. So from there, it is taken as a good around 70 odd years, 7 decades of research. And we even have portable masks right now where we make the athlete wear it in like a haversack and make him run on the track. So this is how it started. You see where to incline, someone had to physically, manually do it, and then incline, and the whole machine was behind. A very cumbersome and a tedious process. Okay, the fourth rather, the force plates. Ever heard of what force plates are, or what do they do? Why is it there? Okay, so it's just the mechanical sensing system designed to measure the GRF and moments involved in human movement. So as I'm moving, as I'm standing, the body is designed in certain way because we are bipedal, that I put my weight equally on both my legs, the right and the left. But for whatever reason, the weight keeps shifting. Now, if I'm standing and speaking before you all, it's okay. But if I'm playing in sport, for example, imagine if there's a batsman waiting. He faces in one side, right? If a bowler is coming, and you might have heard commentators say that, he's a lot more balanced approach. He knows whether he's going front or back. He knows whether he's playing on the front foot or back foot. Or if he edges, he was in no man's land. What does it all mean? The science behind this is the balance and how much of ground reaction force you're exerting. Okay? In philosophical ways, you get what you give back, right? So it's just that. So even when you're sitting right now, you're not sitting equally, although your body is designed to do that, right? Then the technique optimization, loading asymmetries and load distribution on either side, followed by load monitoring, so important. There's something called, the trainers would know, the acute to chronic workload ratio. That is again directly impactful and directly indicative of the injury prevention protocol. We have the old time school of coaching was, you have to work hard, you have to do this. I saw, even so many of the people, they keep on hopping you, hard work, hard work. I mean, I honestly, like in sport, I don't believe much in hard work as much I do in smart work. So it's also important to know when to conserve your energy and when to go for the full throttle, right? Then, so load monitoring comes in effective there, and the use of force plate is quite magical in that space. And of course, for screening and for neuromuscular fatigue. Now, when I say neuromuscular fatigue, when a particular athlete is injured, you're also training the mind. They are hesitant, they are skeptical. If I've had an ankle surgery, they don't want to keep that foot forward. So we have to actually tell them that, you're bearing this load quite well. And if they show them numbers on a force plate that we're doing it, they get that much more confident. And when they come back on the field, it's quite magical. Again, what are the applications? The applications, again, as I told you, I start with an example of cricket when the batsman is taking guard, when he's standing the way it is. If he's facing a bowler 140 and above, he has to maintain a certain balance. Because if he's not maintaining the balance, the reflex goes for a toss. Some, you might see, they are born with it. Some need to work hard. So again, this is again my stuff. We have the force plates here. So that, I'm not sure which sport the boy plays, but looking like a mid-distance runner. again, to see how much of pressure he's exerting on either stuff. And that is again an achievement that we do on my para athletes. He's a double upper limb amputee. He's a swimmer in the S4 category. All the para athletes have a category. So he has no upper limb, ladies and gentlemen. Okay? And he's in a category which uses only his limbs to kick. So it becomes very important for me. So even for a swimmer, you might think he's not talking or he's not running. He is swimming without hands. It's just his leg movements and his body, how well it rotates. So for the leg to kick and propel his body, he needs to have as close to possible equal strength on both his lower limbs. You can do a single leg stance, single leg jump, double leg jump, counter movement jump. I mean, there are multiple protocols. This is just how it's done, and that's the beauty of a force plate. Again, you might have seen this regularly. Anybody who this gentleman and who that gentleman are? No? Footballers in the house? Harry Kane? Yeah? Ex-former England captain. Is he still the captain? No? No, right? Yeah. And that's Mitchell Stark. So you might have seen this in their training sessions that they have these fancy vests that they roam around. Some like to wear it outside, some like to... What exactly is in that vest? Any idea why do they wear it? Or, you know, it's just for fashion. It's like quite horrible fashion, to be honest. But what does it signify? What is it? Ever thought of it? It has a GPS tracker behind, okay, which tells us at the beginning of the session and at the end of the session how much a particular athlete has covered a certain distance, right? So similarly, it's like, you know, tracking acceleration, deceleration, sprint counts, change of direction. Change of direction, very important in a sport like this, which is hockey. That's our Indian team captain, Harmanpreet Singh. And it also helps in enables a comparison between training and match loads. So some athletes prefer to wear it even during the international match when it's going on. So then they compare and contrast as to, are we matching the same intensity in the practice session like how we have it at the match or the game time? Okay, if the answer is yes, that means again the training is going well. And if the answer is no, again, why is it no? Why isn't he matching up at the same speed? Or some athletes we have seen are going great guns in the training session, but on match day, they completely fall flat, right? Then prevents overtraining, assists in recovery planning. So again, we were taking baby steps. Now, I don't know whether you follow the IPL or no. I'm presuming you do. We had Sanju Samson had a side strain, you know, against in one of the matches. So when we were getting him back to ready for the 10th match or the 11th match, we had to track his movement. And we can't track his movement ki, he might have faced 1,000 balls, or he might have run maybe 200 meters. It's not maybe anymore in that environment. Okay? Then again, real-time data and also tactical planning. So this also helps when our analyst is visualizing how our players are moving. So that's an infographic of a penalty stroke in hockey. It also sees how effective our boys are moving to plan and counter plan much better. Then of course, everybody's favorite, the wearables. I'm wearing one now. We have your watches, you have your phones connected to them, the rings, and whatnot. This is again for a very lay population, or some of the athletes also wear it. Tracks sleep, hydration, which will later define the nutrition and how much you're consuming. It gives us a fantastic idea of how much to give to the athlete in terms of nutritional consumption and water intake. Key in lawn training camps, obviously, we can't have the big labs everywhere or the portable devices, or we want to irritate the athletes now and then, so just give them a fancy watch and tell them that it's sponsored. They're more than happy to wear it, and then we can track their movement on our devices and then see how it goes, right? Then of course, in long camps, in the microcycles over a long time, so every 4 years, there's a microcycle, then the meso, micro, nanocycle, and then it comes on to the each rep and each set of what the athlete is doing. And of course, for the female athletes, we have even menstrual trackers, and how that impacts physical training. So everybody, if there's an important final jump in the Olympics, the third jump, you have to go for the world record or the medal jump, you need to have to know at what day it is of your follicular levels, your ovulatory cycle, or what phase of the menstrual cycle that you are in. The trackers are excellent in that way. Some of the examples: hoop strap, continuous glucose monitoring. Now also we have smart shoes. Nike is coming up with one of them. They have the smart insoles, which will kind of tell you at what level of the foot and at which space are you putting that much pressure while running, walking, jogging, or whatever. So this is what the watch will tell. I'm sure any one of you who's using an Apple, Samsung, or the Garmin watch will be familiar with these kind of readings. Resting heart rate. Is this good? A resting heart rate of 43 and a VO2 max of 49. Okay, not okay, pretty okay. I think it's pretty good. I mean, I wouldn't do much to this gentleman with this kind of readings. And then the other part, the most important part actually, is your body composition analysis. You know, I should have actually started my talk with this, because this is what we do when any athlete walks in to know. It's not just how much you weigh or mujhe weight loss kam karna hai or something like that. And we take calls like, I want to lose 2 kgs in the next 3 months. Those are yours and my goal. But at the elite level and even at the recreation level, I think of body composition analysis. What is your fat mass? What is your fat percentage? Skeletal mass distribution. Like, where is it? Is your visceral fat? And this new term come up with TOFI, TOFI. Have you heard of it? It's directly related to all the lifestyle diseases. TOFI is thin out, fat in. Okay, so you might appear to be a very lean person, but if you have fat in the wrong places, you will have poor prognosis and higher chance of comorbidities later on in life. So again, in the clinical environment, it's sarcopenia, very common that every year we are losing 1% of muscle mass after the age of 40. That takes it to almost 8 to 10% per decade after the age of 40. That's why strengthening is so important. And then, of course, post-THR and TKR, a total hip replacement and TKR, it helps in how well you're recovering. So we have some interesting things that we do with, that's the DEXA scan. Very minimal radiation if people are worried about the radiation exposure. But again, it gives you very nice data about how the body composition is. And that is the in-body. Are we done? Oh, okay. I'll just wrap this up quick. So again, the decision making, why are we dealing with so many numbers? So many things, it's all on a platter. Integration of data for holistic athlete care. Then, you know, we sit down, we have our team meetings. The input is there, analysis, and then how to intervene, when to intervene. And the bigger question, do we really need to intervene sometimes? So the drawbacks, obviously, cost effectiveness. Everything I've spoken costs a bomb. Okay? The IKD chair goes to almost 75, 80 lakhs. VO2 max, 25 lakhs. So it doesn't come at a cheap price. You have to justify why you're taking it. If you're having it in an institute, if you're having it in a certain place, you have to justify the cost. Then research, some people don't like research in that elite space because of the privacy of data, which is a big thing in elite sport. Then, of course, the practical implementation, everyone can't have access to all this. So we need to have other ways to go around it. Yeah, the key takeaway is just this: technology enhances clinical judgment. I have a lot of coaches getting scared to use technology. They tell, okay, will I be replaced by it? But so my answer is that you won't be replaced by it. You'll be replaced by another human who's learned how to use this technology. So again, objective data, collaboration between tech and all the medical staff, SNC coaches, sports science team, nutritional psychologists. We come down, sit together, and then come to a final conclusion. That's it from me, ladies and gentlemen. Thank you so much. Jai Hind.
Thank you very much, Doctor, for the fantastic presentation. So I want, what is your key take on this? So we do have a lot of external, internal load monitoring. Like we do a lot of trim calculations, we use a lot of rescue questionnaires, heart rate variability, as you said, acute to chronic workload ratio, a lot of internal, external monitoring we do. But still, if I see the incidence of new injuries, if you see the statistics, it keeps increasing as the year goes by. So in spite of so much advances,
increasing as
the number of injuries.
Okay.
So the statistics keeps increasing. So what is your take on this? In spite of so much advances in the data analysis, load monitoring, why we are not able to still exactly can't prevent or can't bring down the number of injuries?
That's a good question. I have two answers for it. One is that maybe back in the day, we never measured so much to understand that there were so many injuries. So, so it's not that if you don't track it, that there were no injuries in the past. There were injuries, but just that they weren't reported. That's one thing. Secondly is that I see there's a huge divide between elite sport and the recreational athlete, where the previous slide where I told, no? This one. We've made such tremendous progress that we've started to label everyone as something or the other. Now, in a situation like the IPL, you're playing 14 matches over 2 months. The life of an IPL player and support staff is not as hunky. It's only 3 things: airport, ground, hotel. And there's a very high intensity game happening every 3rd day, if you notice. Extremely high intensity. Okay, so back in the day, maybe it was much more spaced out. I'm just talking about cricket. You talk about even the swimming federation, what is happening right now. There are nationals held almost every month. And even if there's no national held, there is an inter-school competition. It's very difficult for trainers to even plan the LTAD or the macro cycle. So how much are we overtraining the boys and the girls? Right? So back in the day when they say they didn't have opportunities, now we are facing a whole sea change where we have only opportunities everywhere. You have a doctors league coming up, you have so many other leagues coming up here and then. So one is the quantity of matches, maybe affecting the quality of matches. And second is that so many over-testing has been done and over-diagnosis, as it in one of the slides, that sometimes the practical implementation, sometimes the best implementation is to not implement anything, just to observe. I think that.
Thank you very much. Any questions from the audience?
Here, sir. Good afternoon, Amay sir. It was a wonderful presentation with a lot of information. I had one question because it was in my mind when I attended one exercise physiology seminar and workshop. There was one foreigner presenter who was talking about, he said Indians can never win 100 meters race. And we just asked, why do you think so? So he was talking like, he was talking in terms of genetic ceiling or the influence of genetics on VO2 max. So of course our athletes have proven him wrong by like our javelin throwers and our shuttlers are proven wrong. But I would like you to enlighten us with this. What is genetic ceiling and genetic influence on VO2 max? Thank you, sir.
Thank you, sir, for the question. I mean, I would partially agree with the foreigner. And the reason is that I'll give an example. You take hockey as a sport, right? We were world champions, 6, 7, I think, medals on a trot consecutively in the 1950s, 60s, 70s. Okay? And then what happened? For 41 years, there was a medal drought. What happened in those 40 years? Did genetics change? What happened? What was there that transformed so much? Did we stop playing hockey? Did money didn't come? Money was not there that time also, it's not there now also. I mean, so that was not there. What happened was that in the 90s and the late 90s, in spite of having the great Dhanraj Pillai captaining our side, we won Aslan Shah and local matches, but never at the Olympic level, which is the epitome of success in hockey. One thing happened is that the field changed. From a grass, natural grass, it changed to a turf, right? So hockey, from a skill-based sport, became a hit-and-run sport. So it took us that much time. In Tokyo, when we won the bronze, it was after 41 years that we won the bronze. Excuse me, sir. Sir. Sir, I'm answering a question. Yeah. So after 40 years when we won the game, the turf had changed. So to plan for that, it took us 5 years. Skill was there. Hit, and when you run, that speed didn't match up with our European and the Australian and Kiwi counterparts. So to come till there, it takes decades of change. So I'm not saying there won't be any in the future, but it will take time for us to get there, depending on how we train. In fact, there is a boy in North Karnataka or in Telangana side who is creating ripples right now. around 20 or so. And also the culture, the running culture. Now it's always been there. Now I'll give another example of Mr. Avinash Sable, 3,000 meters steeple chaser. He won the silver in the Commonwealth Games after almost 27 years. And he's the only non-Kenyan to come on the podium in 27 years. So, but you can imagine since 1992 till 2022 in all the Commonwealth Games, Kenya had the top 3 finishes. For the first time ever, we had a non-Kenyan. So it's not going to happen in a day or even in a year or two. It will take a good 5 years to a decade to train in that particular way. And then hopefully we'll produce an athlete in track too, and not just in field.
Thank you, sir.
Anything else? No?
Thank you, Dr. Ramya Kagli, for this insight into how you train the athletes and what is the role of a physiotherapist. It was really interesting, especially for the people like us who are non-physiotherapy background. So looking at all those pictures.
He's not a physiotherapist.
But he was given.
He's a doctor.
Okay, but you are doing a physiotherapy.
No, he's not physiotherapy. Sports medicine.
Sports medicine. Okay. Okay. So, but it was insightful how you train the sports people and how you tackle the different challenges of the Olympic people also. So, thank you so much for the talk. As I'd like to call upon Pushpa Sarkar ma'am to please come and felicitate the speaker. So, center stage.
Dr. Ameya is a doctor, basically. He's done his specialization in sports medicine, and he goes as a resource person across the globe. Thank you, Dr. Ameya, for being here.
So as a token of appreciation from our end, we would like to give a memento to Dr. Ramya Kagli and a certificate from School of Health Sciences, Dayanand Sagar University. Thank you so much, Dr. Kagli, for coming here. Thank you. We would like to thank Dr. Prabhu Raja for chairing the session. Thank you, Dr. Prabhu Raja, for coming here and chairing the session for us. Thank you. Thank you.